Hey everyone, it's Jordan from Trauma. I'm going to review the art line with you guys for just a brief moment. Art lines are great for patients where you really need to know a good map. So good for our EBD patients. Also any patient you're titrating drips on, vasopressors, things like that. Really good to know what their systemic pressure is, their arterial pressures, and we use that with art line. All right, setup. If you're confused, if you have questions, it is again in the same trauma binder that I used for EBDs. All of your setup is in here about what to do, picture by picture. All right, this is the radial artery catheterization kit. I give this to the provider. This is the insertion tray. This is what they're gonna be using to put the catheter into the patient, into the radial artery. I hand this to them. They're off with the patient. They're doing an Allen's test, if you remember. So that's where they're looking to see if they have good radial pressures. They've got good ulnars, that kind of thing, to see where they're gonna be placing and inserting. That's on them. I am setting the rest of this up as a nurse. This is the tubing that I like to use. It's the True Wave with the vamp. So the vamp is this really awesome piece right here. This allows you to get arterial samples. If this is a patient we're doing routine ABGs on, you really want to be able to use this vamp. All right, and I'll show you guys why. Some of y'all might set this up without the vamp. When they come to the ICU setting, first thing they're doing is transferring that tubing over to this. So think about that, and if that's something that you want to just go ahead and put them on this tubing. The setup is the exact same, which includes removing this from your packaging. Obviously, I'm going to spike my fluids. We no longer use heparin, we're just using a normal saline, LR, that sort of thing. All right, and then you're gonna start priming this, okay? Art line tubing does not want to advance because I don't want to have all of this fluid going into an artery, so the only way that the fluid can advance through is this pigtail right here. All right, so when I pull that, all of your fluid should be pushing through, and you can kind of see, if you can see all my bubbles, and then of course my fluid at the end, I'm primed and ready. I can release that pigtail. Then I'm gonna take my fluids here and I'm gonna place them in a pressure bag like so. Get this up here, make sure to pump it up until it's green. We're gonna just pretend that this is in our pressure bag hanging ready for use. All right, so it's a little bit confusing. This is the end of my tubing that's gonna go to the patient. So as soon as that provider is set up and ready to go, this is what I'm going to hand to them, okay? In the meantime, you need to zero this, okay? And this is what a lot of people get confused with. All right, this piece right here hooks into my red pressure cable monitoring kit, like so, and it hooks up into your monitor. All right, so I've got the monitor on, I've got the fluid side, and then I've got my patient side. Just like anything that we zero, we always start with off to the patient, because I don't care about the patient right now. I need to zero this to atmospheric pressure. All right, I'm going to remove this cap right here. I like to flush it a little bit, give it a little tug, squeeze my fluids. All right, you should see a little bit of a saline pop up here, and then I'm gonna press 0 on my monitor. When I press 0 on the monitor, everything should go flat, and as soon as it does, I will replace this cap. All right, we have like red or yellow ones that will go here, okay? So you're gonna replace that with a different looking cap. All right, and then I'm gonna turn it off to the air, okay? Because that air is doing nothing for me. You are transducing the patient, all right? So as soon as you turn it off to air, you should be getting your readings of your arterial pressures. Where does this live? Where do you wanna place this? Level with the phlebostatic axis, the fourth intercostal space, or the heart, because you're wanting pressures of the heart, essentially. So you'll place this at and about that area, and now your arterial line is good for use. Pretty easy, right? Okay, you're chugging along, you need an arterial sample. This is where the vamp comes into play. So again, I'm going to use my 3-way stopcock, but I'm going to turn off to the fluid because I don't want fluid right now, I want blood. All right, then I'm gonna take this vamp, make sure that this here is open. Sometimes it'll be closed like this. Make sure it's opened. Pressing on the sides of this, you're really gonna have to pull hard, pull, 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 and it's gonna pull back from the patient in through this tubing, your waist, okay? After that, this is where I can access with a blunt needle and a syringe. I can pull from right here, or if you have the needleless devices that can go over on top of this, you're pulling out fresh arterial blood. When you do that, you'll see the blood coming from the patient through this tubing here out into your syringe. All right, I've got my sample, I'm good to go. Now you can return your waste back into your patient by pushing down on that vamp again. And again, you'll see all of that waste coming right back out here. Okay, closing the gate, coming back up to my stopcock, off to air, and it should be back to use. Sometimes I have to re-zero it if I've messed with it too much or the patient has moved around. That's again very simple. Off to patient, open to air, press 0 on my monitor, replace my cap, turn it back off to air. And that's your art line. Thanks.